And belly buttons are very, very important. They used to be nothing but a residual scar from birth, but now it's an object of art which you put jewelry in. So if you have a good-looking belly button, that's a good surgery. If the belly button looks stink, the surgery was a disaster. Okay, how do we tighten the skin down at the bottom so that you don't get a bad scar? Well, Ted Lockwood from Kansas City was a brilliant plastic surgeon who taught us about the SFS, superficial fascial system. Whether you're doing a breast reduction, whether you're doing a tummy tuck, whatever body procedure you're doing, you can actually sew that layer that has fat in it, and it's very strong. So we use suture as thick as kite string to pull that together. And the whole idea is if you take all the tension off down deep, then when you get to the skin surface, you could almost use super glue. I've never had the courage enough to do that, but I know guys that do it and it comes out with great results. Okay, so you want to put in deep sutures, and then just below the surface there's a very, very special well, it's not a suture, it's actually a dissolvable staple, and you put it in upside down. It's called Insorb. I love it. It pulls things together. It's very strong, and it's put in that area of the dermis just below the skin. Then on the surface we put some stitches, we put some staples, but they come out very early. The whole idea is it's not what you take away that counts. It's what you leave. In other words, if you've had a tummy tuck and the scar looks terrible and the belly button looks terrible and there's extra skin and extra fat, what was left was very, very unfortunate. So you want a tight, flat stomach with a good-looking belly button and minimal to no scarring. Sounds reasonable to me. That's what I'd want, and that's what my patients want. And the way we do that is exactly the way I just told you, plus we throw in one extra thing. Surgery doesn't end at surgery. Surgery ends when you get the most perfect result that you can get. And to that extent, once all the scabs are off the suture line, we tape that suture line for months and months afterwards. I have a very special tape that has linen in it. And when you put tape on, what you do is you get literally, and this is, when I first read this, I thought it kind of strange, but now I believe it, you actually get electrons to line up when you put tape on. It flattens the new collagen coming in so it doesn't get thick, and also gets rid of the redness, because the redness is because it's a dynamic scar and you want to get it turned to a static scar, i.e. a white scar. The tummy tuck is part of the deal, but the tummy tuck is only as good as the hips, the thing behind it. So we always liposuction the hips or love handles at the same time as we do a tummy tuck. And if you don't do that, then from the sides it really doesn't look as good as it might. So this leads into liposuction. But before I get there, what are the advantages of a tummy tuck? What does it do for you besides look good? Number one, the abdomen, they always tell you that muscles work together, the pectoralis and the muscles of the back, the abdominal muscles and the muscles of the back, they kind of work in consort. So when your muscles are separated that far, which very often from multiple pregnancies there are, you can do all the push-ups you want to do in the whole world. It won't do any good for you because the muscles go like this instead of straight up and down the middle. When we sew them together, it takes away low back pain. So there have been several excellent articles on the subject of post-abdominoplasty gets rid of low back pain. That's a great one. Secondly, the pens was invented for older women who've had multiple pregnancies because they get stress incontinence. You laugh, you pee, you cough, you pee, and how do we get rid of that? Well, the gynecologists and the urologists have these surgeries where they call it a sling, and they go ahead and bring the urethra up to the pubic bone. Well, the problem is, or the problem that was created by pregnancy, when you get all this loose skin, your vulva falls between your legs, you lose the kink in the urethra. Females only have one sphincter in their urethra, males have two, therefore older men tend very rarely, if ever, to have leakage. Older women very often have leakage, especially if they've had multiple pregnancies. When you get rid of all this loose skin, you bring the vulva up to where it used to be, and therefore very often prevent and or cure stress incontinence. The last thing is that the vulva falls between the legs and everything associated with it does, and so the clitoris is not in a good location. Liposuction is the, if you will, the fourth area of the mommy makeover. Very often, the pregnancy hormones and the necessity to feed a child inside of you leads to the growth of fat that you never had before. Hips, back, thighs, abdomen, and post-pregnancy, many people can get rid of this by running and exercise, but many can't, and it's called baby fat. And so one of the nice parts about or mommy makeover surgery is we can suction out from the knees, from the hips, from the thighs, from the back, this excess fat, actually also from axillary breasts, which I described in my section on post-pregnancy breast augmentation. We can suck all this out. Liposuction was invented in 1975 by Yves Girard-Elouz. It came to the United States in 1982. Most people don't know this, but where it came to was Honolulu, and we all learned about liposuction. It's been around in Hawaii since '83. I did the first liposuction with another plastic surgeon in town in 1983, and everybody knows about it. It works very well, great results. Basic liposuction, using the muscle in your hand to suction out the fat, works great. I have watched over the years vaser liposuction, laser liposuction, ultrasonic liposuction. They all lead to complications. They all are complex. They all don't work any better than regular, with a lot more problems. So a friend of mine in Beverly Hills wrote a great article. He's come out with a new way of doing liposuction. Minimal complications, great results. It's called basic liposuction. You just put the cannula in, suck it out, and if you've done over a couple thousand of these, the results are consistent, and I've done well over a couple thousand. So liposuction as a part of a mommy makeover is a very nice and very simple way to go. Post-operatively, we use ultrasound, the same machine that the physical therapist uses on sore muscles. It makes you get normal or back to what you expected to look like at 1 month instead of 6 months. For friction, if the clitoris is not in a good location for friction, it takes a lot of pleasure out of life, especially after you've had your children. When you do a tummy tuck, everything gets brought back into a much better location. That's an abdominoplasty.